What you want, when you want it, where you want it. This is The Mesh.
Hey everybody, this is Dr. Matt, and this is Take Back Your Health podcast, where we talk about all things health and ways to help you be the best version of you. Hey everybody, this is Dr. Matt, and this is Take Back Your Health podcast, and I'm here today again with a guest that I've had on the show before, Mandy, with Goal-Oriented Health and Fitness. Did I say that right?
Yes, you did.
I always have to make sure those people that have the long names, I have to make sure that I say that right. Well, Mandy, welcome back. I'm so glad you could join us.
I'm glad to be here.
We're going to talk about something that we both deal with on a daily basis with our clients, which are occupational hazards. So I know what those are. You know what those are. Why don't you explain to people what I mean by occupational hazards?
So occupational hazards are, from my industry and my aspect of it, are things that we do on a daily basis that are not in the proper form. Mm-hmm. So whether you're sitting at a desk and you have hunched over shoulders, or maybe your wrists aren't in the right spot, or people that are on lines that maybe stand all day and they're locking their knees in and versus using their muscles, bending, twisting, squatting improperly, not having the right muscle balance to be able to hold your skeleton in the place that it should be.
Yeah. And yeah, that's exactly what I say. And I also say the desk workers, hairdressers, mm-hmm. plumbers, people that are bad posture, basically is what we're dealing with. And the problems that come from that. So typically what I consider occupational hazards are the plantar fasciitis, the carpal tunnel, the sciatica, or what I usually refer to as the piriformis syndrome, because sciatica is usually a catch-all term, tech-snag, thoracic outlet syndrome. Those are the big ones that I usually see on a regular basis. And then there's some extensive ones like frozen shoulder. We can get onto all that. But these issues are common. They're not normal, but they're common. And I usually find that patients struggle with these because of bad posture and jobs. And I'm sure you have patients that come to see you because they're having trouble walking, because their feet are hurting, or they're having neck pain because of, posture, things like that. So what do you start with when you have patients that have issues with that?
So I'm actually going to use some clients as examples. So I have a client that's a writer, and although she is an author, awesome. Yeah, she's written more books, but she has a series that is 50 books at this point. So she's a serious author. Yeah. And she had that little hump on the back of her neck mm-hmm. because she kept sitting at her desk and her shoulders are rounded and hunched over. Mm-hmm. So I gave her some very specific exercises, and within just a few weeks, she was already feeling less neck pain. Mm-hmm. And then after I had seen her for a 3-month protocol, and after the 3 months, the hump on her neck was gone. So you can correct those things, but mm-hmm. she was definitely having some neck issues, which then extended down into some low back issues because mm-hmm. the neck and the low back, the whole spine works together. Mm-hmm. So that, and then yes, you brought up the feet issue. So walking, if you're standing a lot, and again, if you're not using your muscular system and you're using your joints, your muscles become imbalanced mm-hmm. and they can't do things appropriately, which our body needs to be appropriate in order to work without pain. So, mm-hmm. So we do anything that it needs to be. So a lot of lunges for the low back or legs or knees. Even for plantar fasciitis, we do lunges, we do some calf raises, toe raises, anything that is going to affect the lower body strength. And then the upper body, I have 3 very specific movements that work for the neck and upper back mm-hmm. that people get almost out of pain within a couple of weeks. So,
what are those?
So one of them is I call it the goalpost or a T rotation. It's hard. It's podcast, so I can't really explain it, right? But
Talk
you're
us
in,
through it, Mandy.
you're in like a goalpost scenario with your arms straight out, and then you just rotate your arms in a goalpost manner. So like you would be like like a football goalpost.
Going up and down.
Yeah, going up and down. So your shoulders would be, or your arms would be out from your shoulders, and then your elbows would be bent straight out. And then you would rotate them up and down, making sure that you're contracting the muscles the whole time. The other one is your hands would be behind your back, like if you're like
behind your head.
Behind your head. I'm sorry. Like I guess you would put like you're being arrested. Yeah. And then you just bring your elbows forward, and then you pull your elbows backwards. Okay. And again,
that engages your traps. And
your
scapula,
and your pecs. So,
your pecs,
and your scalings and your, everything. So, the very little muscles that are super important.
That cause you the problem.
Yes. So, and again, I think some of these I know because I was a massage therapist and I worked with a lot of occupational.
You were a massage therapist, so you have the secret knowledge.
I do. Right? So, and then there is one other one, kind of an S wrap along the back. That one's most women's favorite because as we age, we lose mobility in our shoulders and we can't hook our bra straps. And that one, every female's like, oh my gosh, I can hook my bra strap again. So those are three specific ones that I work for the upper body. Mm-hmm.
Well, that's good. And people ask me all the time, patients say, what, that's usually the first question. They say, what's some good exercises I can do at home to help with this? And I'll usually give them the typical things, like piriformis syndrome is usually one I hear a lot of.
Yeah, that one's a big one.
Yeah, the sciatica one, I have patients. I have sciatica. You probably don't have sciatica.
Right. It's more piriformis.
It's more piriformis. Sciatica is usually chronic, and it usually has different symptoms, but that's what everybody usually says. But going back to what we said earlier about the imbalance, that's basically the cause of all these issues is postural imbalances. Which is good in the aspect that they can be corrected. Yeah. Most people think, I have plantar fasciitis. It's genetic. My grandma had it. My mom has it. I was like, well, that's a component to it because obviously, you have the same kind of feet that they do. If you were born with your grandpa's feet, he has that. You're more prone to have it. But then again, if you take better care and you realize what's causing the problem, you can fix it. And posture is 100% correctable. Yep. But it is a process because obviously I tell patients it doesn't happen overnight, so it can't be fixed overnight, but it can be fixed. But going back to as far as occupational hazards, all of these issues, the carpal tunnel, plantar fasciitis, the sciatica, it's basically just overuse. They're overuse injuries is what tendinitis, things like that.
Not necessarily because you can have two people that do the same thing all of the time, but one person can get the issue and one wouldn't.
Some of those issues I'm thinking more like tennis elbow, golfer's elbow, plantar fascia. A lot of those are tendinitis because that's what's inflamed.
Yeah.
Text neck, things like that, that's not really considered tendinitis, but it's more of the chronic, constant state that we are in that causes these issues.
Yes, if you're improperly using them. So like if you are strong enough, so I'm going to take tennis elbow for instance, because we're currently seeing it because of pickleball, right? So people are like, I don't understand it. Well, if your muscular system is not strong enough to control your motion, you're just basically like winging your arm around. Yep. So that strain on your tendons and your ligaments from your upper arm to your lower arm are just getting...
You're fraying the rope.
You are fraying. That's a really good example.
Yeah, I would say you're fraying the rope, you're overusing it, and it gets frayed, and then eventually it snaps or it rips, and then that's when it causes the problem.
Yeah, and then that's where like chiropractic comes in to kind of get things into situation or back into place, and then building that muscle structure back up so that you're strong on either side of that to not put as much strain on.
Chiropractic is good at fixing the mobility and the structure, making sure everything's aligned correctly, and then yours is more of like retraining the muscle memory and the right motion.
Getting it strong.
Yeah, exactly. Because function dictates structure. Yeah. Or, sorry, reverse that. Structure dictates function. So if the structure is sound, then it's going to work correctly. And obviously, if it's not.
And the same thing kind of goes with plantar fasciitis. So I worked really heavily with a chiropractor when I was a massage therapist. And we would see them. And we would see plantar fasciitis. If you're vertebrae and your pelvis is off, you're walking goofy and wonky, which puts more strain on one leg than the other. So your feet are also going to be affected by that. So if you can stay in alignment through chiropractic care, and then build up the muscles, you're going to have less.
Gait is a big thing. Walking, people don't really pay attention to how they walk.
No.
It's funny when you actually record people walking and you're like, do you know that
they have no idea?
I know. It's like, do you know that you walk like that? Do you know you walk with like one foot flared out? And they're like, oh, never even noticed that.
And I do that in my assessments. People are like, what are you doing? And I'm like, I'm watching you because I need to know what muscle imbalances you have.
Your hip bother.
Right?
Yeah, I know. Exactly. It's funny how it's like that. In posture, I do the same thing. When I do a posture scan on every new patient, I do a head weight.
Yeah.
So it tells them how much their head weighs and how much their body thinks their head weighs.
If they're like this.
Based on the position that it's in. So I have, I had a 26-year-old patient in here yesterday, and she had decent posture. Wasn't great, but she had a little bit of a text neck, and she's got a 12-pound head normally. But based on her posture, it weighed 30. So I'm like, you're carrying around like more than double the amount of weight on your shoulders.
Yep.
And that's why your neck's hurting. That's why you have headaches. That's why your upper back's hurting, because it's trying to pull your head back. It's like pulling the horse's back, and that's causing extra strain on your muscles because your pecs are weak and you're tight and they're pulling you forward. That's why people got the Gothic shoulders, the little hunched over shoulders.
Well, and the other thing too that is a component in that is our stress level. Like everybody walks with their shoulders up to their ears
I know,
right
everybody's
now.
trying to put their shoulders in their ears.
Yes, and if we continually do that, our structure just cannot handle that.
When I do my assessments, I'm palpating people's back, kind of finding knots and stuff, and everybody has got this set of evil twins. I call them the evil twins because there's two big knots in both shoulders, and I'll dig my thumb in there, and they're like, "Oh my God, what is that?" And I'm like, "That is the cause of your headaches right there." It's just it's posture. So as far as cause the issue, talking about how to help fix it, easy ways to treat these issues. I usually recommend ice and rest as first treatments because, if it's an overuse injury, stop using it. Rest it. Most people don't know how to do the 4-letter word, rest.
No. As soon as it feels good, they're like, I'm back out here. And then they're like, it hurts again. I'm like, because you didn't let it rest.
Oh, it feels good. I get back out there and play again. Like, oh, it's back. I'm like, yeah, exactly. But ice and rest is the two first treatments that I usually recommend for that. Because that's
for an
the
acute.
best there. For acute, yeah. Ice it when it hurts, rest it when it hurts. But for more of the chronic issues, things like that. So I have adjustments I can do. I do cupping, I dry needle, things like that. Definitely helps more immediate relief when it comes to things like that. What are some ways that you do with your clients when it comes to dealing with some of these issues?
A lot of stretching. So I do incorporate stretching into my programs that they get for the week. They get at least one stretch day, sometimes two, based on the person. And then it's always strength. Based on what their needs are, because we can stretch and stretch and stretch and stretch. And if we're not building the strength up to hold our body in the proper form, it's going to continue to hurt. Same with the tendonitis, the elbows, golfer elbows, the football players that were quarterbacks that threw football after football after football. They have the same issues. And if they aren't keeping their muscular strength strong, it's just going to be a chronic issue. So the ice and the rest is good, but resting for so long, you have to be cautious because a lot of times the doctors are like, well, just don't do it if it hurts. Well, now you're creating a whole nother problem because you're not allowing the person to actually get strong in a situation that they need to. So like people that have chronic disc issues, chronic lumbar, like compressed discs, the doctors are like, well, then just don't do that motion. And it's like, well, you need to build the strength up so that you can hold your body and you're going to have less instances if you can have that strength in. So it's just a lot of strength building. And again, there's some stretches and walking, like if you do nothing else on a daily basis, to walk and move your body, just get the things flowing. So,
no, absolutely. And when I say rest and ice, obviously I don't mean to stop.
Yeah,
I mean
but the cute wise,
Yeah, exactly. Yeah.
Stop playing tennis right.
Yeah, don't quit what you enjoy doing, but like obviously don't overdo it. Most people have the tendency to just push through things.
Yes.
And then that's when they start developing the really bad issues because they're like, yeah, it hurts, but it's been hurting for years. And now it's really bad. And they're talking about maybe having surgery and yada, yada, yada. I'm like, well, that's because you literally, the alarm was going off and you
didn't listen. No.
And
sometimes
we deal with that.
Sometimes too, you run into a situation, I'm sure you see it too, but people will come in and they are fine. Like maybe they did have surgery and they know that they're not going to injure the issue, the area anymore, but their brain is protecting them. So their brain is not allowing their body to do the motion. Somebody that has a knee issue, right? So they're like, I can only do this. Well, once they learn that they can do more, it gets them back in the proper form. Like their gait is better. They're walking better. But again, it's that you're teaching the brain that it can do that stuff.
Yeah. And the brain will do things as, I don't say defense mechanisms,
yes.
but it's like if it knows that it doesn't like this, it's going to not want you to do that.
Yep.
And then you're going to form compensations, which are worse in a sense because now you're learning new, bad forms of motion. And now you've got this wonky hip or my foot pops every time I walk or yada, yada, hear everything. Because you're compensating and your body's not used to that. When I do my tension scans on my new patients, I explain I do that as a visual so that way they can see, hey, you say you have tension in your neck, but I want to show you where you actually have tension and where it's exacerbated. And it's funny because sometimes it's not even where they have the pain. Mm-mm. And they're like, well, why is this so high up here? And this is where the pain is, but it's higher up here. I was like, well, that's because down here it's not working correctly. And up here it's having to overcompensate. Right. So it's overstrained and it's angry, so to speak. So it's going to be lit up like a Christmas tree. And that's why you're having these issues because this down here is causing the problem. It's like if your right foot is not working correctly, your left foot is going to have to work twice as hard to counteract that balance and that weight. And then eventually the left foot's going to go out and the right foot's the reason they're having a problem.
One, a lot of times, and I know you see this, but they'll come in for like neck pain, right? So then you adjust them and they're starting to feel better, but they're like, well, now my low back hurts. And I'm like, well, your low back probably always hurt, but the neck was worse. So now that's good, right? We're like working down to get to the root of the cause.
Pushing those demons out of there.
So.
What else did you have written down? Because I had a couple. You had a couple points that I think you wanted to address too.
Was the stress levels? So that
stress is obviously most people's cause of problem.
Yeah, I mean, and it can disrupt your physical being, but then it also disrupts your sleep, which then makes your muscles fatigued, which then, and also one that people don't think about is if we are sitting all day, we have a higher instance of diabetes and high blood glucose. So it is becoming more and more of an occupational hazard because we're sitting more than what we ever used to. So, and we are exposed to food that isn't fantastic.
We can talk about food all day. But diabetes, high blood pressure, all that stuff, depression, anxiety. I mean, that comes from, the job, usually, and the poor posture. Did you have anything else?
Everything else.
Okay, I wasn't sure if you had anything else to add. But real quick, so how can people get a hold of you if they weren't listening to the last podcast?
I am on the social medias on Instagram and Facebook under Mandy Bottke, Bottke. And then my website is goalorientedhealthandfitness.com. So you can reach out to me at any one of those. And I do encourage you to follow my social media because it does have some good stuff. Some of it's funny, some of it's more serious, but it does have some good things and ideas for you to do at home because that is what I believe in. Like, we don't need to spend hours in the gym. We just need to work on some functional movements and get our body moving. So
you definitely need to follow her social media because she makes me laugh, and that's a feat right there. No. But the thing I love about Mandy is, and I hear this from other people too, is that as far as personal trainers go, you're more, I won't say real, I should say, because you don't over promote going to the gym, working out, busting your butt.
It's about functional.
Exactly, because you kind of more like meet you where you are.
Yep.
Okay, you're 53 years old. You don't have time to do this, but let's see what you can do, and we'll work from there.
It's better than nothing.
Exactly, and I think that's what people do. They think, well, I don't have time to join the gym, or I don't have time to go to this place, so I'm just not going to do it.
Yep.
I'm like, well, you don't have to do those things, but you can do these and still get benefit out of it.
Yeah.
And that was with any part of being healthy.
Yeah. And I do specialize in 30-minute or less workouts or movements in your week. I mean, it's just, and at home stuff and things you can do. You don't need to be at a gym. You don't have to have a membership. You don't have to have all sorts of time. Instead of scrolling on the phone, you can move your body.
I know. It's what's so sad is you look at your screen time and see how much time you're spending on the phone. You're like, you know what? I spent 4 hours before I went to bed scrolling on Instagram. I could have at least used 30 minutes to do some squats, right?
Yes.
I know. Well, real quickly, I know people, you told people how to get a hold of you. Kind of, what do you offer? I know you do group packages, group rates, individualized, et cetera, et cetera.
So I do in-person and online coaching. So I do personal training, both online and in person. I do have clients all over the country, which is kind of fun and kind of a mishap. Like time zones are kind of iffy when I'm scheduling, but, and then I do health coaching as well. So, if you are somebody that just maybe needs to get off the couch, or their doctor's like, you need to diet and you need to exercise, and then that they leave you and see by. I help with that. And again, it's all realistic because I'm not an all or nothing person. I'm like, you have to live your life. It's reality. You want to be able to go and have that cake or that ice cream. We just learn to do it not every day. Yes. Yeah. And be okay with it. No guilt. Like that's my biggest thing. Everybody's like, well, now I ate the pizza and now I can't, it doesn't matter. I'm just going to start over. Yeah. So, and I do offer like group training 2-to-1 if anybody in person is interested in that. But then, so I offer online classes, courses. I have programs a couple times a year that are group. So it's a little bit more affordable for people. So.
Awesome. Well, appreciate you coming out here.
Thank you for having me. I always like it.
Oh, always love it. If you'd like to learn more about what you just heard, or if you're interested in scheduling an appointment to see how chiropractic can help you, visit our website at newdirectionschiropractic-nc.com. Be sure to follow our social media page for more information on how to be a better you.
You've been listening to The Mesh, an online media network of shows and programs ranging from business to arts, sports to entertainment, music to community. All programs are available on the website as well as through iTunes and YouTube. Check us out online at themesh.tv. Discover other network shows and give us feedback on what you just heard.